Olá, bem-vindos a mais uma edição do SBC Podcast, gravado diretamente ao vivo do Congresso Brasileiro de Coluna, da 19ª edição do Congresso Brasileiro de Coluna, na cidade de Recife. É com grande prazer e grande honra que eu apresento aqui para vocês hoje Dr. PEDRO BERJANO. Dr. PEDRO é um amigo de longa data, um habitué dos congressos de coluna no Brasil, já frequentou inúmeras atividades científicas no Brasil. Um grande amigo, né, até pessoal de muitos dos cirurgiões de coluna residentes aqui no Brasil, conselheiro de muitos cirurgiões. Já recebeu na sua cidade inúmeros colegas de profissão nosso e influenciador, enorme influenciador de muitos dos cirurgiões do Brasil. Para a gente é um grande honra, um grande prazer receber PEDRO BERJANO aqui. So PEDRO, very, very nice to meet you, to have you here. It's a wonderful time. I know that you came to Brazil many times. It's always a big pleasure for us to have you here. I know probably this is your first Brazilian Spine Society meeting, the big meetings.
It is.
Yeah, but I know you have been here many times before, and there's a lot of surgeons that visit you in Italy, and you visit Brazil for many years. You help to train a lot of Brazilian surgeons, so you have a strong connection with the country. And I want to say, in behalf of the Brazilian Spine Society, I want to say thank you very much for all the efforts and all the good job you're doing, training people, inspiring people, and helping people to do better surgeries. I want to invite you to be free to talk about your connection with this society and with all the people who visit you, and many times that you came here. And I want to make this space free for you to talk whatever you want and feel comfortable.
Thank you very much, Rodrigo. It's a big pleasure. It's always a big pleasure to come to Brazil, despite the distance. And this is a very special occasion because this is my first time in Brazil after being appointed as a member of the Brazilian Spine Society. That I consider a big honor in my curriculum.
Yeah.
So thank you very much for having me.
So you have a very interesting professional life because you from Spain, Madrid.
Yes.
And then you moved to Italy, and you worked part of your time in Switzerland. So you kind of international spine surgeon in Europe, and you also travel a lot, influencing people in US and also Latin America. Can you tell us a little bit more about your life as a spine surgeon and how you decide to move from one place to the other? This whole journey.
Yeah, it's very difficult because life happens to you, and sometimes you steer that. Sometimes there are coincidences, sometimes there are opportunities. But I think that maybe the only constant in this journey has been curiosity.
Yeah.
I'm always very curious, and I'm always very excited of doing new things, trying new things. And I think that is the characteristics that has made me able to take advantage of all this. I was born in Granada. I'm the son of a teacher and an employee. My family is a very humble one, and I studied medicine in Granada thanks to my family. One very nice thing in my family is that there was always all the budget we wanted for books. It was the only thing we could spend money without asking for a special approval. And I think that has been very clever in my family. They always invested in our culture, always invested in our education.
I would say that knowledge is the only thing that people cannot take from you. So
exactly,
this is very smart.
And yes, I became a physician not because of my choice. I wanted to be a professor of literature or maybe a writer. And then my mother and my tutor at the school, at high school, convinced me to do what they thought was something else. I don't think it's something else, but for them it was like a higher level of using your brain and your possibilities. So they convinced me to become a doctor. And the trick they used was there are a lot of doctors who become writers. So you have a chance there. And also medicine has been a strange journey. I started being a family physician, and I'm very grateful to that training. In Spain, family medicine is a formal training with a 3-year residency, and that gives you a very good knowledge on how to approach the patient, also on the psychological and psychosocial aspects of human interaction that happens in medicine.
Especially in spine, because we're
Right.
treating severe disease patient with a lot of psychological background. So this probably helps you a lot in the clinic.
Yes, of course. And I think that was the reason, that background made me attractive for the spine surgeons when I started orthopedics. I became an orthopedic surgeon because I wanted to do technical things, and the knee was my hope. So I started my residency in a hospital that was very well known for good performance in arthroscopy and sports medicine, sports orthopedic. But it happened that my first rotation was in spine surgery, and it got me completely. So that is the thing. Sometimes there are things that you don't choose, but if you are curious and you are moved by passion, at the end they become as interesting or more than the things you had in mind.
Yeah, I think probably this is the reason, because you inspire so much people, because you have passion in your professional life, and it's pretty clear for us when we see you having giving a lecture, or even talking about surgery. It's very clear for everybody that you love what you do. So probably it's the reason for this so inspiring personal type. So
yeah, I believe that what concepts don't get people engaged. What gets people engaged is human being.
Oh yeah.
And I think that there's no particular merit, but I understand that I put my human being in my communication with people, in my work, and it works. It works. It helps you to be happier doing your professional life. It helps making better connections to patients when you consider them not a number, but a person, try to understand, to interact with them. And that doesn't mean that you have to become friends with them, but you see them, the person that is in them.
You admire your thoughts, and also your behavior in front of a situation. Can I ask you how your connection and your relationship with AO Spine begins, and how you create such a astronomical career into the society, and what do you think is the strengths of the AO in terms of international society?
Yeah, it's again something which was random. You know that years ago, after I moved to Italy, and in Italy I started doing general orthopedics, then I met Claudio Lamartina, who is now my partner, but has been my last mentor. And once he told me, you should join AO Spine, because when I go to an AO Spine meeting, I meet people who are as clever or more than I am. He is a funny guy, and he said, and that doesn't happen very, very often in real life. And I took that challenge, and I realized that in AO Spine there is a culture of collaboration, there is a culture of respect, there is a culture of growing together that is really enlightening, and that makes of you not only a better surgeon but also a better individual. I really believe that.
We can say that AO Spine right now is the only real international spine society in the world. So probably there's a lot of efforts in North American societies, SRS, European Spine Society, but there's no society in the world that can put together the diversity of surgeons that AO can do. So
that's absolutely true, and that's because I don't think that AO is a society. I think that AO is a community. That makes a big difference.
That's big difference.
And I, if I may, I would correct your first statement. You said I did an astronomic career, and I think I didn't do a career. I'm doing a service, which is different. I think that the beauty of AO is that people who get to high positions in the governance, or to relevant positions in the governance, think first not on their own reputation, but of what can I do for this community. And that's one of the beauties of AO.
Even advocacy, that is one of the only international society that is doing guidelines, advocacy for spine surgery. So there's a lot of good things coming from that area.
Yeah.
Congratulations for your, I would say, service.
Thank
and
you very
thank
much.
you for this service, because everybody take advantage of this.
Yeah, I think that one of the beauties of AO is also that the mission is clearly improving patient outcomes. It took a lot of discussion to decide this very simple sentence, but improving patient outcomes through education, research, and innovation. And that is what AO does, and what AO Spine, I think, is doing in an even more relevant way than all the AO does.
Absolutely. So I think the partnership between AO and the history of AO Spine with the Brazilian community has been there for a long time. And of course, we appreciate a lot all the results that we collect with this partnership. And I hope AO can continue to be supportive to the Brazilian Spine Society. We host here in Recife a pre-meeting with the AO Spine, and was an outstanding meeting. The full room for the whole day. Good discussion, and I hope this will be continue for many years. I hope you can be here with us more often, and I know your OR is open for visits, because
always
I personally send you some of my ex-fellows to visit, and I want to just say thank you very much for all the support and all the service that you're doing for AO, for the Brazilian Spine Society, and the bottom line for the outcome of the patients. Thank you very much.
Yeah, thank you very much. It's always very reciprocal, the pleasure. Yesterday I met Andre Castillo. Andre Castillo spent with us like 3 months years ago, and I remember that we spent a lot of time together. At that time I was still having a practice in Switzerland. We were traveling together by car. We sat next to each other for long days, and we had a lot of discussions, not only about medicine, not only about how to fix the angle in the deformity, but very much about life, about career, about your feelings, about how you plan your personal life. And yesterday it was a blessing, because I met him and he told me, that those 3 months did not change my technical view of surgery. I went there to learn about lateral surgery.
Oh, okay.
And says, but I learned about life, and my life has changed about that. And that is something that the AO Spine Fellowships do very well. There are opportunities for a life-changing experience. I have seen that in many fellows. I think that you have, all of us, when we receive a fellow or a visitor, we have the responsibility to give that much to help them changing their feelings, their life, their careers, because that's ultimately going to help.
Building a personality, and this connection helps, to improve the way they see life. Yeah, absolutely.
And the other thing that I have learned with this is that many people who do this and who have that experience come and say, how can I pay back you? How can I give back to you what you and your team have given to me? And I think that I always tell them, you don't have to give back. You have to give forward. So 20 years ago, Daniel Rosenthal had me in his home, bought me a pizza after the OR, and I didn't give him back anything, but I'm giving forward to people coming later. I think that is what we should see as the best practice, as the best goal in our lives.
I will probably correct you a little bit, because this is the meaning of giving back.
Yeah, giving back to life.
Giving back to the universe. Yeah, beautiful. You still cycling?
I still cycle, not as much as I would like, but yes, I love bicycles, I love running, I love all these kinds of activities.
If you have to say one short testimonial for the young generation, what would be, the word, the thought that you want to...
3 words. Travel with curiosity. That is the thing. Travel. Why travel? You know the term idiot. Idiot has an etymology. It's idios, place. And idiot is someone who only knows one place. So the immunization against idiocy is traveling. But traveling passively is not enough. You have to travel with curiosity, asking you what, why, how can this be translated into my life? That kind of continuously asking and reflecting on what you are doing and on what you have done is what makes the difference.
That's amazing. Thank you very much, Pedro. It's a big pleasure for us. In the name of Brazilian Spine Society, And on my personal behalf, I want to thank you very much for the collaboration, for the service that you doing. And please keep pushing forward. Please keep giving forward whatever life and the universe gives to you. Thank you very much.
Thank you, Rodrigo. I have to say that you rock this kind of interviews.
Oh, really?
You're a rock star. Thank you.
I'm getting used to it. Thank you.
Thanks.